Good afternoon. Today I'm going to be performing a simple spirometry or pulmonary function test checkoff. So when doing the procedure, first of all, we would give some instructions to the patient. So one of the instructions to be done is we would let the patient withhold their bronchodilator or inhalers for at least 6 hours prior to the procedure, and even smoking for at least 8 hours prior to the procedure. And then we would also give them instructions to wear comfortable clothing and also take light meals for the next day. So when they come in the PFT room, we would always take their height and weight, and then also take note, we should also obtain the pre-assessment vital signs such as the heart rate, respirations, their blood pressure, and their SpO2. And then I would also try to take this pain assessment tool or the pain score. So the reason why I include this one is I would like to know if what the patient is exhibiting, if they're exhibiting any pain currently, which may affect their performance. So once we're done with that, we would also try to ask some questions to the patient. One of the questions we usually ask is their medications. Aside from the respiratory medications, we would like to know if they take any cardiac drugs, and then their medical history. We would also like to know if they have any underlying conditions or any procedures that they have undergone before. So once we're done, we would also encode all those stuff in the computer, and then we will always explain to the patient what's the reason, such as, good afternoon, my name is Anthony. So I'm a student respiratory therapy. I'm here to perform the procedure. So this test is what we call the simple spirometry. So the reason why you're being done with this procedure is we would like to check your lung capacity, if how much air move in and out from your lungs. So once we're done, we would always coach them through demonstration for them to fully understand the procedure. So assuming the patient is in front of me, so in here I will let them know that you should sit, relax, and then back should be straightened up, chin straighten up, not like that, and then they should not slouch. So in here, assuming the patient is inside the body box or the plethysmography or using a portable PFT, there will always be a mouthpiece. So with a mouthpiece, ensure the patient should take a good seal on it with no leak on the sides. With their tongue underneath, it should not block on this airflow. And then we will also put nose clips on their nose, so that way there will be no leak. So first of all, we will tell the patient to do normal breath for at least 3 to 5 times. So when you try to look at the patient through their breathing pattern or in the graph itself, so if you take note of their expiration, after that we will tell the patient to take a deep breath in. When they take a deep breath in, let them know that they will try to think of it like they're drinking a soda via straw. So when they take a deep breath in, like that. And then after taking a deep breath in, you tell them to blow as much as they can or blow as hard as they can. So our goal for that, we will try to look at the graph if they're able to reach 6 seconds exhalation time. So we tell them to blow as much as you can, blow as hard as you can until you feel your lungs are empty. So you also tell them that try to think of it like they're trying to blow a birthday cake full of candles. So after taking a deep breath in, blow. Continue blowing hard until you feel your lungs are empty. After blowing hard, let them instruct to take a deep breath in. So that's the test. That's how the test is being done. So by doing a normal breath, take a deep breath in, blow. Then take a deep breath in again, like that. So after doing the maneuver, we usually do the test at least 5 attempts or more depending the patient, and then we would always choose 3 best FVC maneuver. So usually after that, we would give bronchodilator to the patient to check for any reversibility. So after giving the bronchodilator, we usually let the patient rest in order for the medication to take effect for a couple of minutes. So after with that time frame, we usually go back to the procedure again. So once everything is all done, ensure that we will try to let the patient rest a little bit, take again the pain score if they experience any pain, obtain the post-assessment vital signs, and then ensure that everything is all good, and then we would always include it, indicate it, what are assessment and observations in our test report. That's it.